بسم الله الرحمن الرحيم. نبدأ معكم بتدريس المحاضرة الأولى في Health Administration or Health Management. طبعا بالنسبة للcourse description you will skip it. These were the lectures that this course will be introducing to you. What is the purpose of knowing something about the healthcare system? So we are trying to understand what are the factors that interfere with our provision of healthcare system in order to make things easier for doctors and for patients to get the best outcome of healthcare services. As the healthcare system advance in time and in size, the complexity of healthcare system following the increasing service provided, numbers of healthcare facilities, and all of this, in addition to the satisfaction or dissatisfaction of healthcare professionals with the delivery of such healthcare system, and the factors surround such satisfaction or dissatisfaction, in addition also to the consumers who always complain of high cost or insensitivity of healthcare professionals to their needs, the lack of organization of work in healthcare facilities and low level of care, and more of factors such as the external and internal factors surrounding the healthcare system. All these will place an increased pressure on the system and its administration to improve the performance. So, as we see, the purpose is to improve the performance of our healthcare system. Of course, when we say healthcare system, later on we will define these things: the healthcare, the health, the system, the service. But what I'm trying to tell you is that we need to improve our healthcare provision as a function of the healthcare that we provide patients. This information, which is about some history about Jordan, these numbers are old, and you can dig in the literature on internet and see what are the budget, the personnel, number of personnel, number of beds, hospital. This comes with the increasing complexity and demand on healthcare system. So if we introduce ourselves to the word health, according to the WHO, the health means the absence of disease, illness, impairment, and or injury with complete physical, mental, emotional, and social well-being. It can be regarded as a continuum of well-being, including a good quality of life at the end and sickness at the other end. From this definition of health, it's the absence, not only the disease or illness, but also the impairment and the injury. So, if we look at the health or the health provision as a model, the person or the individual or the patient should come out with complete, healthy, complete, without disease, without illness, with complete physical and mental. So we should not make any injury to this patient, whether it's mental, physical, emotional, or social, at least not from our side. I mean, we should not impose any harm to this patient, any kind of harm, whether it is physical, mental, emotional, or social. We should be very much gentle with provision of make good health status possible, or as this is the third. Before we were talking about the healthcare system, which is an organized effort. Organized effort means it's not haphazard. It means not something that you work alone without knowing the goals or the policies and so on. But in the same time, you are delivering healthcare service. It is based on a set of predetermined goals. So now we are talking about goals here, which is in the same way the goals are looked at as policies. So healthcare systems vary in each country according to the policies, according to the predetermined goals, the insurance, the goals of the country regarding making healthcare universal for all or not. The administration of such healthcare system is the planning, design, and determination of health care system policy or policies, the execution of these policies, and then not only that, the evaluation of such policies. So the healthcare services, healthcare organization, and facilities should be viewed as part of a whole system or body in which all members operate interdependently, which means that we don't work as individuals separately. It should be looked at in the same time one big body of goals or institutions, hospitals, healthcare centers, NGOs. All of it should deliver healthcare system or healthcare services to people who are in need of such services, with standards, with policies, with goals for such inconvenience. So if we take one more look at this model, it's now time to talk about efficiency. Efficiency, it means that with, as we see, input, process, output. Efficiency means with the least input in the first, with the minimum input, we get the most output. Don't be confused with the best. It is the most. The best, it's about quality, but now we are talking about efficiency. Efficiency means with the minimum resources you have, which is the input, you get the best output. This is the efficiency, and we go back to talking about the developing systems for booked outpatient appointments, admissions, and procedures to permit better planning of activity. Undertaking as much activity as possible on an ambulatory rather than an inpatient. It means that we should not always admit patients if there is no need, or we can do it on ambulatory, which is daily. There's a section in the hospital which is a daily surgery or daily procedures, whatever. There is no need for admission. You just being booked for this procedure. You don't need. They don't need to admit the patient. They do it at ambulatory base. Evaluating the staff skill mix and the potential for skill substitution, as well as efficient payment strategies. So it is about evaluation. But when we talk about staff skill mix, it means that we can train some of our staff to have many skills needed later on. This means we have such employee, technician who can do a lot of things, but he is absent, or this technician or this nurse is absent, so he is the only one who can do this. So such service will be stopped. We don't need to do that. So skill mix means more than the one skill that you have. You can do many skills that we will need to do later on. Evaluating and improving processes and systems, including cost-effective clinical guidelines for patient treatment on a continuous basis. Also, cost-effective, it means clinical guidelines. It means that also with such cost that we are doing or giving or treating or diagnosing or making any effort in clinical service practice, it should give effective treatment or effective output. That's why we call it cost effective. It means that with all things that you are doing, whether money or physical activity, the outcome or the output should be effective. It also gives some perspective regarding the efficiency, the effectiveness, excuse me. Effectiveness is means that you are providing effective, which means successful procedure or treatment. That's effective. But the efficiency, it's about different thing, which is about saving. Efficiency is about saving, or with the least you are doing the best. The most, not the best. Now, adopting intelligent procurement processes and engaging in effective negotiations with suppliers in relation to prices and service level, ensuring effective ordering, stock control. These are also a good management things that should a manager look at when trying to purchase or deal with suppliers, making negotiation to prices, effective ordering. You don't want to come to a point say we don't have this treatment, we don't have this diagnostic test, we don't have. This is a bad strategy for health system administration. Undertaking planned preventive maintenance and programmed replacement of equipment and buildings.